The world is changing before our eyes. Natural disasters, civil unrest, health emergencies. Events like these have upended our everyday lives at an alarming pace. Now more than ever, we need clarity to follow God's path for His people. Join us as we tackle the hard topics in a fusion of discernment and hope. Welcome to Infusion Forum.
Good afternoon, everyone. Good evening, wherever you are. We welcome you to Infusion Forum this afternoon. My name is Christiana Jima, and I will be hosting today's discussion. Infusion Forum is a forum that discusses thought-provoking ideas. We pull together people from various fields of expertise, as well as in the academia, to discuss issues that surround our well-being in these last days or in these end times. I will go ahead and introduce us to today's topic. And today's topic is a very interesting topic because it touches on in vitro fertilization in the contemporary Christian community. What are some of the ethical implications? What are some of the issues that surround this interesting topic, or topic that we do not really discuss on a daily basis in our church communities, as well as even in our homes? The commandment that the Bible gave, or the background to this discussion, stems from Genesis chapter 1, verse 28, where God tells us to be fruitful and multiply and replenish the earth and subdue the earth, and take control of the earth. And because of this command in the Bible, we do not shirk those responsibilities of having children and also pursuing the means of having children. When we look at the story of Tamar and Judah, Judah was supposed to give Tamar his son so that she could start a legacy. And due to the fact that that legacy was being delayed, she took an unconventional means to trap Judah somewhere along the line, and got herself pregnant. Lot and his daughters also found themselves, or Lot found himself in a very confused state when his daughters drugged him, and they also had children. And we realized that this is not new, especially when it comes to our contemporary Christian walk. The idea of going according to God's precepts, and also ensuring that we leave a legacy by way of having children, is something that everybody looks forward to. The pressure of having these children, and the societal pressure, the emotional turmoil, and everything that goes into this journey of fulfilling this desire, has landed us into this very great topic this afternoon. And so this afternoon we have with us Dr. Janice, Dr. Janice Whyte, who is an assistant professor from Loma Linda University. Dr. Janice, welcome to Infusion Forum.
Thank you so much, Christy, for inviting me, and I'm really looking forward to the conversation this evening.
Thank you. And Dr. Linda Amankwah is an emergency medicine physician. Dr. Linda is here with us to shed light from the medical perspective. And let me backtrack a little bit. Dr. Janice will be helping us go through some of the discussions, the ethical discussions in the Bible, and bringing out those biblical themes. And Dr. Linda would help us understand what it means in the medical field, what it means in science, and she will be really giving us all the scientific background and what it means. to have this topic. And so welcome, ladies, to Infusion Forum. Welcome, Dr. Linda, and
Thank
thanks
you.
for accepting our invitation. So we will pause here and go on a quick break whilst we start our discussion.
The world is changing before our eyes. Natural disasters, civil unrest, health emergencies. Events like these have upended our everyday lives at an alarming pace. Now more than ever, we need clarity to follow God's path for His people. Join us as we tackle the hard topics in a fusion of discernment and hope. Welcome to Infusion Forum.
Thank you for joining us again. If you are just joining us, we are just about starting our discussion on in vitro fertilization and the contemporary Christian community, its ethical implications. Dr. Linda, I think I would start this conversation with you because we cannot have any fruitful discussion without understanding what this whole procedure or what this whole IVF or what we call assistant reproductive technology is about. So are you able to walk us through what this whole procedure is and why would individuals even consider going through such a procedure?
All right. Thanks for having me. This is quite an interesting topic, and it's rightly so that we discuss it. I think it is a territory of a lot of uncertainty, and people don't have quite a clear understanding of what it is, and partly because it's a new field. And so it's nice that we get to talk about it and shed some light on it and, open up, I guess, just get a clearance of what it's really about. When you talk about IVF, it's actually under the umbrella of assisted reproductive technology. And these interventions or medical interventions are utilized in assisting couples and individuals who struggle with infertility. Keep in mind that infertility is a very common issue that plagues a lot of couples and families. And so it is a medical intervention that has been developed to assist in these situations. And so specifically, IVF stands for in vitro fertilization. And it is utilized in situations where a couple, for whatever reason, the sperm is unable to meet with the egg to start the process of fertilization and to develop into a baby. And so whatever the circumstance may be or the situation may be preventing that egg and sperm to meet, or sometimes in situations where the sperm is actually able to meet the egg, fertilization is unable to take place. And in these circumstances or these situations where couples are having difficulty conceiving, IVF can be adapted to be able to use to get these couples past that hurdle to be able to bring about having children. We can go into the procedure of it. Oftentimes, it's not a very, I wouldn't say a smooth process for a couple to go through. Before a couple will come to the decision to want to utilize this technology, they would have had to be thoroughly assessed by their physician to determine if this means of reproductive technology would better fit or answer their fertility needs. And so it starts out when you try to understand what in vitro fertilization means is when you say in vitro is a procedure or process that takes place outside of the body, as opposed to in vivo, which takes place within the body. For natural process of conception to take place, you need the sperm to travel through the vaginal canal into the female body, specifically in the fallopian tubes, where it'll fertilize or meet with the egg and fertilize. And after that fertilization process, the zygote or that fusion or fused cell migrates into the uterus, or what we would call the womb in the layman term, where it will implant into the uterus, where the process of development of the fetus starts and grow. And the process of, at the end of 9 months, you have a child. This is what happens in vivo, or within the body, within the organism. In vitro attempts to mimic this very natural process by taking that process outside of the body and doing it in vitro, which is outside of the body. So what it basically does is it fertilizes the egg outside of the body and eventually introduces that zygote or the embryo back into the female body and allow the natural process to continue or to begin. So it is a detailed process, and I'm just going to touch on just the points, not just a simple overview of it. Prior to the whole process, family, the couple will have to go for an assessment to identify where the issue of infertility is. What is causing that infertility? Is it a female factor? Is it a male factor, right? Or is it both of them? And once we are able to identify where the issue is, we can then suggest what the best means of intervention is. So if IVF happens to be the best or the right choice for the couple, at that point, what happens is the woman will have to, prior to even this, a couple would have had to attempt to naturally conceive for a period of 12 months, a year, to be able to be deemed infertile and be have met the criteria to some extent for IVF. So prior to the IVF process, the woman will have to take certain medications to stimulate the ovaries, which naturally would produce eggs, typically just one egg every cycle. But in this situation, they stimulate the ovary to make a lot of eggs, because the more eggs you have, the higher chance of success with the IVF process. So once the ovary is stimulated for a period of time with certain hormones that are given to the female, the eggs are eventually retrieved from the female's body, the ovary. Once these eggs are retrieved, they are taken outside of the body. And that's the part where that in vitro, outside of the body, begin, where the egg is combined with the sperm. Sometimes if there is a male factor with the sperm not being able to have the ability to penetrate the egg to fertilize it, they may have to use a procedure where they actually take the sperm and inject it within the ovum or the egg to begin the process of fertilization for them to fuse. If that process stage is successful, after a period of days, sometimes 3 days, 5 days, 6 days, that embryo or that zygote, or that fusion of the egg and the sperm now becomes the embryo, is taken and reintroduced back into the female's body, the uterus. And prior to that, the female would have taken certain medication to prime the uterus to prepare it to receive that embryo in order to aid in the process of implantation. If it's not optimized, the environment of the uterus is not optimized, implantation cannot take place. And naturally, your body produces certain hormones to prepare the uterus for implantation in just the natural form. And so medications are given to prep the uterus to that extent. And once the embryo is implanted, if that stage of implantation is successful, then natural process takes over, where the pregnancy has to be maintained by the mother's body and the hormones produced. Oftentimes, medications are also given to help sustain that pregnancy for the first few weeks until the placenta can develop and take over. At that point, the rest is in God's hands. And so that's sort of the gist of the process of IVF specifically. And couples that are struggling with infertility may choose to go that route. I hope that brings some clarification.
It does. Thank you so much. That's a very detailed preparation even towards the whole process. And so to you, Dr. Janice, does this whole process outside the uterus, outside the body, and all the processes that one would have to go through to become pregnant, how does this help fulfill God's injunction or the command or the issue of be fruitful and multiply? Does this go in line with what God wants us to do, or is it something that we think is too much outside God's plan?
Thank you for that question. I really appreciate the explanation from Dr. Lind. I think it's important for us to hear that because many of us are making decisions, finding that IVF may be helpful, but we are making a decision not to even explore the area or research it because we don't have this basic information. So I think that's important for all of us to hear. To your question, in Genesis 1:28, we have the blessing where God, creating Adam and Eve, he says to them, be fruitful and multiply. This is repeated again to Noah after the flood and his family. What we take from that is obviously that God creates human beings with this capacity to reproduce. However, this has been taken by some people as a sort of imperative, right? An indication that one is not fulfilling their divine purpose or their divine calling unless they have children. And that really isn't the thrust of the text. Of course, children are a gift from God. As we see elsewhere in the Bible, Psalm 127, it talks about, children being a heritage or inheritance, a gift from God. But when we come to infertility, it's important for us to really remember what we're talking about here. When someone has a particular impairment or illness, there's something going on in their body. We don't often, as much as we do for infertility, assign that to some kind of fault of the person or to say that they're not fulfilling a divine purpose. So this evening, part of why we're doing this program, I believe, is to kind of raise awareness and sensitize people that infertility is a very real journey. For some of us, it will be a real journey, and we really need to, as a church, as community, people of faith, particularly who hold the scriptures to be normative, that rather than picking these texts in isolation and concluding, we need to look at the whole of scripture. And we will find, as one of the stories that our host alluded to before, that people get very creative to try and solve their fertility or to realize their fertility desires. And our host, Christy, mentioned one such narrative that we have in the Bible. So for anyone who thinks that assisted reproductive technologies is a new thing, it's actually been going on for a while, and there are ancient forms that are tested. So perhaps we can talk about some of that as we go ahead with the program.
Thank you. Thank you very much for that answer. And with that said, and this question is for both of you to help us understand, does this carry any stigma, the procedure? Does it carry any stigma at all? I'll go with you first, Dr. Linda.
Well, I would say infertility in of itself carries a stigma, which is unfortunate because oftentimes it's not the doing of the individual or the couple to have found themselves in that state, But infertility carries a stigma. And I think that goes along with the interventions for obtaining a child. It kind of goes along with that. There are a lot of women who would try to hide the fact that they've had IVF just because of the stigma it carries in society. People assume certain things about it. And I think, as I was saying, it's a fairly, when you talk specifically about assisted reproductive technology, it's a fairly new medical intervention within the matter of 30 to 40 years, which is fairly new for medicine. And so, and it's becoming more common now, and people are becoming more aware of it. But within the mainstream society, it's not that common, and people are not that knowledgeable about it. And I think sometimes when there's that sense of something outside of us or something that is foreign to us, we tend to ascribe certain stigma to it. And so it's a common thing to find that IVF particularly carries a stigma, especially when people have had multiple pregnancies. People already assume, especially if you've had issues of infertility and people are aware of it, and you have multiple pregnancies like twins, triplets, people automatically assume, oh, he or she might have done some form of reproductive technology in obtaining these children, and it carries with it certain stigma within the society.
Yeah, thank you. Dr. Janice, any comment on the stigma that goes with this procedure?
Yes, absolutely. Infertility is stigmatized. Depending on where you're coming from in the world, your ancestry, your heritage, that can also compound your sort of personal experience through this. There are cultures in which, fertility, reproduction is not, something that you do. It's not just something you do, it's a rite of passage. And in some cultures, for example, as a man, as a woman, you can accomplish this, you can, have these graduate degrees, you can have this kind of job, you can be a fantastic person. And yet in some cultures, until you have a child, people will not sort of look at you as, having achieved something or reached a particular, significant milestone in life. And so for an individual or for a couple who is going through fertility issues, there may be people in their community who look down on them, who say all sorts of hurtful things. There are also natural things that will happen as well. When you're part of a community, you will see others transition through parenting, having new babies. All of these things will impact someone's journey of infertility. So I think it's very important for us to talk about the stigmatization surrounding infertility, and really talking about it also from our particular cultural location and context, recognizing that many non-Western traditional cultures, reproduction or having children is a serious rite of passage. And how do we treat people who are on their way to this rite of passage, or who currently cannot be in this rite of passage? I think that's a very serious thing to be discussed in religious communities as well. As we reference these kinds of scriptures, children are a gift from God. People may ask themselves, well, if children are a gift from God, why haven't I received that gift? And so there can also be this dimension of spiritual pain, spiritual questioning as you go through such a journey.
Thank you so much. And someone would like to know if this process is painful from the medical perspective. Would it be a very painful procedure to undertake?
I would say different stages have different level of pain. If you're referring to physical pain, there's certain amount of a level of physical pain from giving yourself daily injections, right? We all can attest to it, that having shots, whether from when you were a child getting immunization to whenever as adults getting flu shots, it's not a pleasant experience. And women who have chosen to go through this have prepared themselves to go through the physical pain, which involves the daily injections that you have to give yourself up until sometimes even after pregnancy. And then when it comes to the retrieval process, you can present with some cramping, not severe pain, but there's some cramping involved. And even when you've had the transfer where there's they reintroduce the embryos back into the uterus, there can be some discomfort and pelvic cramping with it. So it's not, I think the biggest part of it is more the emotional pain. The psychological stressors are more intense than I would say the physical pain, from what people have discussed.
Thank you both. Thank you, listening audience, for your question. We encourage that you post your questions in the chat. We are live on Facebook and live on YouTube. If you have any question, please feel free to drop those questions in the chat box. We will take a quick break, and when we come back, we will look at, from the Christian perspective, some of the ethical implications and some of the issues that surround in vitro fertilization. We will be right back.
The world is changing before our eyes. Natural disasters, civil unrest, health emergencies. Events like these have upended our everyday lives at an alarming pace. Now more than ever, we need clarity to follow God's path for His people. Join us as we tackle the hard topics in a fusion of discernment and hope. Welcome to Infusion Forum.
Thank you for joining Infusion Forum. If you are just joining us, we are discussing in vitro fertilization and the contemporary Christian community. What are the ethical implications? Our next line of question kind of goes on the ethical lines of discussion. So Dr. Linda, what happens to the excess embryos, as you mentioned earlier? What are some of what is done with it, and how does that work?
So when a couple decide to go through assisted reproduction, they're oftentimes with a thought or the mindset of having perhaps 1, 2, 3 children. They've planned their family size. And like I said initially, when I was talking about the procedure, is that in order to increase the success rate, a large amount of eggs got to be retrieved after the stimulation process. And sometimes you could end up with many eggs, over 20 eggs that are retrieved. Unfortunately, some people may end up just getting no eggs fertilized in the end of it and end up with nothing to go home with. And the alternative, some people may also end up getting more eggs fertilized than they had initially planned or wanted. So a couple may go in wanting to have 2 embryos or 2 eggs fertilized so they can have 2 kids in the end, but may end up with 4, 5, 6, good quality embryos that could potentially end up becoming children. Under these circumstances, there has to be a decision made as to what you do with the rest of the embryos. Some people may even have a couple, and their situation may change. They may get divorced and choose not to proceed with the whole transfer process, or the female may die, the husband may die. A lot of circumstances may come about. And so in that situation, there are several ways that these embryos are dealt with. First, they can be frozen indefinitely, but that's a costly option, right? You gotta, couple would have to pay yearly to maintain that embryo until when they're ready to use it. So if you're not going to use it and you're going to want to keep it indefinitely, the cost adds up. Secondly, you can also choose to donate the embryo itself to a couple who is also struggling with infertility. Sometimes their women may not have the quality of eggs to even get it to the point where it can be effectively fertilized, let alone get to the point of it being transferred back into the body. So they may need to adopt an embryo, obtain one somehow, or get eggs from somewhere and begin that process. So you can donate the embryo to another couple. You can also choose to donate that for research, medical advancement and research. And lastly, you can choose to have that embryo just be thawed out, right? They're frozen to keep them in a state where they can be utilized later on if the couple chooses to. But if they get thawed out, they basically are done away with. So those are sort of the 4 options that I'm aware of.
So with that said, Dr. Janice, does that constitute murder if these embryos are being destroyed and are just being tossed somewhere if they are not used?
It's important for us when talking about these things to, these are what we call bioethical issues that it's hard to make one blanket answer for everyone. Depending on your particular faith tradition, your religious convictions, this is going to be something that will present differently for every individual or couple navigating this. So, for instance, if you are Roman Catholic, then maybe this is going to present a real issue for you because, in that worldview, life and personhood in particular begins at conception. That is to say that even this embryo is viewed as, a person, potential person, and therefore thawing them out, as Dr. Linda has described, for some would be viewed as an act of murder. But I think in other Christian communions, other Christian denominations, the idea or the understanding is that this embryo needs that support, needs that nourishment to really flourish and to grow. And therefore, if for some reason you have excess and you choose to thaw out the embryo, you choose to donate to science, for example, that these things are all legitimate and actually many Christian churches would leave that decision down to the couple. So you will not find, for example, a lot of churches making sort of policies or mandates about this. At the end of the day, this is something that the individual, the couple, depending on their religious convictions, are going to talk about and then process together.
So with that said, will this be something that only the rich can afford, or is it something that is available to anybody who is interested in pursuing this option?
I think it's available to pretty much everyone that's interested. However, it does come with a great cost. It is not a cheap procedure. It costs, lots of money to do it, depending on where you are. I'm sure you may find them to be cheaper in other countries than they are maybe in the United States or in Canada. And certain governments have made provisions for women who have underlying medical infertility issues that can be identified. And those individuals could be qualified to have it covered by their country's Medicaid or health plan that they have. I believe in Canada, for instance, if a physician can prove that this woman has this particular condition that's preventing them from being able to conceive naturally, their health care does cover it to some extent. Also, I believe certain insurances, even within the United States, will cover it, again, if there is a medical indication for it. But overall, I do agree that obviously for the rich, it's insignificant amount of money for them when they are faced with these challenges. And there are some people that don't have the insurance and don't have the financial means to be able to go through this process. So anyone, it's accessible to everyone, but again, it depends on where you are and the type of insurance you have and your financial state.
Right, thank you. So going back to the real issue of the prepping the body, sperm donation, harvesting the eggs, hormonal treatments, and all that. Does this process have any risk, or does it pose any risk to the mother or to the one who will be carrying the child ultimately?
Well, I think there is no medical intervention without risks. Even if taking a Tylenol itself has risks to them, right? Nothing is without side effects and risks. And the risk can be looked at from the time where you are doing the stimulation of the ovaries to the retrieval process to just the steps involved, right? The medications do have side effects. Some women report feeling bloated. They can have a lot of water retention. They can have nausea, fatigue, mood swings. So the medication in of itself do pose some risks to the mother, but these tend to be short-lived. It's only during the time you're taking the medication, and I don't believe there are any long-term effects or consequences as a result of taking the medications. There have been certain conditions that have been implicated, but not truly supported with research. I believe there had been instances where there was a documentation of increased risk of ovarian cancer, but that again has not been authenticated or it has not been supported by research thoroughly. And there have been, like I had mentioned earlier, the physical pain of giving yourself injection in of itself can be quite traumatizing, physically traumatizing to women. And I think probably the biggest effect will be more the psychological impact, the emotional, mental strain and drain on the family, the couple, and even the woman is predominantly, right, having to go through a procedure where your body's put through so much, and then in the end you carry that sort of the stigma of infertility all your life, and you're praying and hanging on to this final hope that this thing will work, and it's not 100% successful. A lot of women go through this without coming out with any children, and that can be very traumatizing for a couple, and that can put a lot of strain on marriages and on individuals, can cause mental health issues within the couple, and also within the mother going through this process. When you become pregnant with this child, you have an increased risk of having multiple pregnancies, which in of itself also poses other risks, right? Anytime you have, even whether naturally or artificially, a woman is conceived with multiple pregnancies, they do tend to have higher risk of complications, whether it be preeclampsia, which is pregnancy-related hypertension, or they may have certain pregnancy-related issues that, like gestational diabetes. Sometimes they could even have rupture of like the placenta tearing from the wall. Just the higher level of number of pregnancies, fetuses you're carrying, the higher that is, and that tends to be higher among IVF utilized means of getting pregnant. So definitely there are certain risks associated. Patients can have partum hemorrhages where they bleed out, most of these patients end up having to have C-section, which also carries other complications and risks. So there are various risks, but I think the biggest one would be more of the psychological, emotional trauma, physical trauma that patients or mothers have to go through.
Thank you. That's a very good perspective of looking at it from both the emotional, the psychological, the physical aspect of what, a woman would have to go through to achieve that purpose. Just turning a little bit to the process of sperm donation and it being tied or linked to masturbation and other ethical implications that this method or methodology carries. Dr. Janice, what's what's the general ethical implications when it comes to this method of sperm donation if one would have to go through masturbation and other forms of impurities that are listed in the Bible?
So again, we want to emphasize the importance of really educating ourselves, doing our research. We want to also invite, an openness, a curiosity, so that we don't make our, sort of life decisions based on kind of really dominant narratives that may not necessarily apply to everyone. So essentially, when you go for IVF, even before that, you sometimes men will have the male factor test, and so we want to the physicians will want to analyze their semen to make sure or to check out, if there's anything going wrong that may be contributing to the infertility. And so many times or often men will masturbate so that they can ejaculate into the container that they're provided, and then that will be analyzed. But here's the thing that's very important for us. When we educate ourselves, we will know that healthcare professionals are here to serve us, and you can access healthcare from physicians and specialists who are very, culturally competent. They understand that people are coming from different cultural backgrounds, different religious backgrounds, and you can actually access healthcare where they do give you the option. If you prefer not to go that route, you can request for cultural, for religious reasons. I prefer not to do this. And one alternative that's offered is they give a special sort of condom that is made from a different material than the ones that you usually buy in the shops. And then so that the man can, when having sexual intercourse, he can use that special condom to collect his semen and then, deliver that promptly to the clinic, for example, where they are being treated. So I'm only saying this because I think a lot of people aren't aware that there is this option. And so even something like this, many people will just discount IVF and say, oh, well, I have an ethical concern with masturbation, and therefore, this isn't even an option for me. I am imploring us and inviting us, please do your research, have a talk with your physicians. There are great healthcare professionals that really are culturally competent and understand that there are people culturally and religious that have culture and religious reasons as to why they can't pursue that traditional route, let's say.
Thank you so much, Dr. Janice. But back to the psychological effect on women or on mothers pursuing this route. Dr. Linda, can you expound more on that, since there isn't much talk about the emotional, mental trauma as we move along the lines of understanding how this process affects the offsprings as well?
Well, I think women go through a lot when it comes to infertility and this whole process. as we had mentioned, there is such a stigma, ongoing stigmatization of women that are infertile for centuries, right? We've dealt with this. So a woman who may find themselves with fertility issues is already, harboring and carrying a lot of burden on their hearts and on their minds. And then when it comes to going through this process of potentially having their own biological offsprings, which I think naturally we all want to do. And that process in of itself also poses psychological strain. Again, part of it is because of the uncertainty of the procedure that you're going through and the possibility that you may not be successful in the end. There are many women who report having gone through IVF multiple times and come out empty-handed. And that can be so traumatizing that it rendered people end up being depressed for a very long time and having a lot of psychological or mental health issues. When you talk about the offsprings of these mothers or couples, then you kind of get yourself into situations where you may end up having multiple births, whether it be twins, triplets, quadruplets. And that in of itself also poses another strain on the family, whether it be financially, just socially. It's difficult, even with pregnancies where children are conceived naturally and you have multiple births. That is such a strain on family that it sometimes even end the couple in a divorce, right? Because of how hard it is to care for even one child is difficult, let alone multiple children at one time. And sometimes because IVF carries a higher rate of multiple pregnancies, and multiple pregnancies have been known to end up in preterm labor, low birth rate, these kids may end up with just the usual complications and birth defects that multiple pregnancies bring, whether conceived naturally or through IVF. So that in itself become another strain, right? The mother, the family, or the couple would have to address the ongoing medical visitations and the financial strain medically, especially when you live in the United States. If you have a child that's ill, that is such a huge strain on the family. And should you end up having a child that's mentally challenged, physically challenged, that puts a huge strain on the mother. So you go in wanting to be a mother, right? Be a father, and you come out with a child that's unwell. That in of itself is another challenge that you have to face.
That leads to the question for Dr. Janice, along the lines of, from a Christian perspective, would that be considered punishment from God? Or as we know, our cultural disposition goes towards the fact that if one goes outside God's design, they are prone to having all kinds of misfortune that will befall them. And to Dr. Linda's point about maybe running into an issue of having a child with disability, and the mother having gone through all the pain, only to come out empty-handed. Would that be considered a retribution from God, or how do we process that as Christians?
So some have processed it that way. Some will read all sorts of things into when a child is born. If there's a particular challenge, impairment, disability. And I think one thing I'd like us to be cautious about is doing that in the case of IVF. Okay. What we want to do is say that infertility is already so stigmatized. It already carries so much hurt, pain, questions. a kind of existential suffering that we don't want to compound when a couple actually is able to have a child. We don't want to compound the difficulty that they have of trying to navigate how to care for their infant who may need special help, special assistance, by then sort of reading in all these meanings. At the end of the day, there are things that we can speculate about, but we just don't know. What makes me passionate about this particular point is we often look at these things and we tend to talk about these things so that people who potentially this could be a helpful way to go maybe may not even start on the road. So I want us to and I'm saying this in particular because there may be someone watching who is thinking about this journey, this route, taking this route. And we really want to encourage people to do your research, talk to your healthcare professionals. If you are a person of faith, pray about this, really take your time, but don't allow the kinds of negativity that often we say, dissuade you if this is the path that you choose.
My apologies, I was talking on a muted mic. That's a very good point. Dr. Linda, just one point before we come back to you, we would like to encourage our listening audience that you can post your questions down the chat, and please subscribe to our channel and share the link with friends and families as we all learn from these professionals what it means to have an advanced technology when it comes to our reproductive health. Dr. Linda, would you want to add just a little bit to what we already talked about? Just some finishing touches to that as we move towards the end of our discussion, taking the last questions.
I just wanted to add to what Dr. Janice had said about making sure you're doing your own research to better understand the process that you're about to embark on before you do, and not necessarily listen to sort of hearsay. There are a lot of people who would discourage you from a process just because of their own personal viewpoints and whatnot. I think we're referring specifically to congenital abnormalities or anomalies with these children born of IVF. There has not been any significant differences in terms of their upbringing, whether it be their mental health, cognitive abilities, physical abilities. When you compare them to children born naturally, there has not been any significant differences among those factors. So there were researches that had indicated possible birth defects, but when you do a meta-analysis or you take multiple research and you analyze it, there were no significant differences between the two groups that were compared. And also some of the birth defects that were realized or may have been a small risk that was noted was more related to the state of infertility and not specifically to the process of IVF, of the procedure in of itself. And it may be more related to issues of infertility or conditions that whether an infertile or subfertile woman have a child naturally versus IVF, the risk of birth defects would be the same among them, because the factor that is causing that increased risk is related to the state of infertility and not the procedure in of itself. I just wanted to make that clarification.
Thank you so much for the clarification. And now as we move towards the idea of commercialization of human fluids, we know that when it comes to the issue of infertility, it is not only the women who have some medical concerns. Some men also experience low sperm count that contributes to the issues of infertility. So would it be a good, I mean, from an ethical point of view, will this be the case of commercialization of the human fluids? Does this have any impact on society at all?
Can I just say that when you talked about this idea of the role of men or men's experience in the infertility journey, I think actually that's a really key point for us to make in this discussion, that men and women experience infertility. And when you know, again, I like to look at sort of like the ecology, right, or the environmental issues affecting these sort of experiences. When, as cultural groups, we socialize our boys, you know, we need to socialize our boys to understand that this isn't just a women's issue. You know, this isn't something that women cause and then they have to just take care of it. And somehow men are sort of marginal characters on the side. We need to socialize our boys and to educate our men as well to understand that their role doesn't start with sexual intercourse and end with ejaculating, if I can say it so bluntly. And the reason why this is very important is that part of the stigmatization and the trauma that often comes along with infertility and other forms of reproductive loss is this sort of isolating or this gendering of the experience, so that men are left out of the equation. I'll just give you an example. When we begin to socialize our boys and men to understand that they're collaborators and partners in the experience, then even, for example, the way that some men do relationships may possibly change. So there's a dominant narrative within Christian circles that women are in abundant supply and men are limited. And some men have taken that you know, a bit advantage of that. And so you have people who, you know, are dating people for 8-9 years, they'll leave that relationship, they'll go and date someone else for, you know, 5 years, and so on and so forth. We need to help our young men and our men understand that you are just as responsible for your sisters, and sisters are just as responsible for our brothers. And the same expectation that is placed on women to know about prostate cancer, to make sure that their fathers and their sons and their husbands get their annual checkups and, you know, are staying well. We need to place that same expectation on our boys or our young men and our older men, to understand that they also too need to be invested in women's health. So I think, I know that wasn't your actual question, but just a point that you made, which I think we really need to share with our audience.
Yeah, thank you very much. That's a very, very good way of looking at it, because we live in a society where everything that's termed or deemed as negative going on in the home environment is normally pinned on women. You hardly hear of men wizards. You always hear of women witches, you know, which is, you know, it in itself kind of creates that barrier. But thank you so much for bringing that awareness that men would have to be responsible as much as women would have to be responsible. With that said, as a single person considering some of these medical intervention gain or to start a posterity or a generation, what are some of the social implications or what are some of the harmful effects that we see amongst single people considering this? And this would be a question for either Dr. Linda or Dr. Janice to take on for us, just to see how these perspectives would go if a single woman or a single man is considering going that route. Any one of you can go.
I'll let Dr. Janice take this question.
Okay.
This is a difficult one, and it's difficult to give a definitive answer, because I feel that we need to again zoom back and ask, what is it that is fueling the desire, let's say for a single lady or for a single man, to go through IVF, or let's say adoption, to have a child of their own. Again, I don't want to assume that all our listeners are coming from a Christian perspective, but that's the perspective that I'm coming from. So I will speak from that context. The narrative that I alluded to earlier, where you have this, narrative of an abundance of women and there's limited men. And so in some men's minds, that means, more dating partners, that means more options, and that means more time. When we socialize and educate ourselves, our brothers, to understand that when you as a man, you are involved in a string of relationships and every single one of them is long-term, you are possibly impacting that sister in a way that right now you may not understand. There are some women who reach, their late 30s, early 40s, and they've been in very serious relationships, committed relationships, that haven't worked out. And now they're at a stage of their lives where they're saying, well, I haven't seen a marriage partner that I feel will be right for me, but I still have this real desire to be a parent, to share that love and pass that on. So I think that rather than sort of having judgment on those individuals per se, I think we need to zoom back and look at the larger culture. Is there a culture that we are living in that is promoting this kind of perception and viewpoint that some men are then taking advantage of? And of course, we all have our volition and we all have our choice, but that can end up impacting the way that I then date and choose a partner if I get married late. So some women are in that boat. And I think it's important for us to look at these environmental factors in Christian churches that are not actually helping. The other aspect of this, which is important, is even if you have an issue with exploring IVF, as a single person, you have reached a particular age, stage in life, and for whatever reasons you don't think that you have found that person that you want to marry, be in that committed relationship with, do I think that there is value in exploring adoption? Absolutely. I think this is something we don't often talk about in the church, but there are many children who desperately need love, desperately need great homes, desperately need great parents. And I think Christian churches need to have this honest and open conversation about how we support individuals who are in that boat, who say, I will love to parent a child, and I'm not yet married.
Wow.
Excellent.
That is just, the icing on the cake when it comes to kind of drawing the curtains down on this very interesting discussion that we've had. Thank you so much, Dr. Linda Amankwah, and thank you so much, Dr. Janice Whyte, for your insights, your input, and for leading us to understand that we don't have to feel we don't have to carry all the burdens of life alone. God has given us all these resources and all these professionals and the science behind it to help us explore other alternatives and other options to equally fulfill the desire of having children. Yes, we need to ask God for directions and go according to our conviction and according to what God is leading us to do. Either way, either how we take this, we still would have to think through and be supportive of those who are going through the trauma, who are going through the issue of infertility. It would be very helpful for those of us who sit on the sideline to offer a word of prayer and be very encouraging and not to ask unnecessary questions sometimes. Even if the question is necessary, we have to be very sensitive that the route of having children doesn't come as easy for some. And so we have to be very supportive. If you joined us late today, we were discussing the topic under in vitro fertilization and the contemporary Christian community, the ethical implications that come with it. Thank you so much, doctors. We sincerely appreciate your time and input. And to the listening audience, we thank you so much for your questions, your support, and time. Please subscribe to our YouTube channel, Infusion Forum, and like us on Facebook. Share this video to encourage couples, to encourage singles, to encourage anyone who is on this life journey so that we would have a very well educated perspective when it comes to this discuss in our homes. Thank you all so much for joining us. Have a very, very blessed week, and we will be meeting again. Thank you.
The world is changing before our eyes. Natural disasters, civil unrest, health emergencies. Events like these have upended our everyday lives at an alarming pace. Now more than ever, we need clarity to follow God's path for His people. Join us as we tackle the hard topics in a fusion of discernment and hope. Welcome to Infusion Forum.